Another cancer screening that is done especially for women who are on bioidentical hormone replacement through either perimenopause or menopause would be for endometrial cancer. So the endometrium is the internal lining of the uterus. And the internal lining of the uterus can be stimulated by estrogen. So if you are on bioidentical hormone replacement, which is estrogen and progesterone, that's molecularly exactly the same as what your body makes naturally, it can stimulate the lining of the endometrium to grow. And so you want to make sure you haven't stimulated any abnormal growth or masked any possible growing cancer. And the way we do that is with an annual endometrial ultrasound, also called a pelvic ultrasound. So if you're on estrogen and progesterone, you should have once a year a pelvic ultrasound, in addition to your once a year mammogram to screen for breast cancer.